It seems like only this morning that I was standing here and you were presiding over the Senate. And I got through about half of my remarks and we ran out of town, and I had to yield to that fellow from Maryland who sits behind me. And now that no one's on the floor, I just want to take maybe 5 or 10 minutes and finish what I started to say this morning. I don't know if it's possible to ask unanimous consent that my remarks this afternoon be appended to and joined with what I said earlier today. If that's something that can be done, I would appreciate it.
Without objection.
That'd be great. Thanks so much. But, as you may recall, I was talking earlier today about how to reduce the amount of overpayments. We call them improper payments that the federal government makes. And last year, they added up to almost $100 billion, not counting the Department of Defense, not counting part of Medicare, not counting part of the Department of Homeland Security. It's a lot of money. And and having said that, I also added that federal agencies are doing, for the most part, a better job at estimating and identifying those costly mistakes or improper payments. I think the White House deserves credit. Not only this White House, this president, but his predecessor, George W. Bush, deserve credit for not only, in the case of George W. Bush, saying we ought to have improper payments law and we ought to make this a priority, but also for President Obama and his team for beginning to scour federal programs for improper payments, and also taking strong steps to try to eliminate them in the future. White House Budget Director Peter Orszag noted that agencies employed stricter standards for identifying improper payments, resulting in much of last fall's reported improper payments increase. I remember maybe 5 years ago, when Senator Tom Carper and I were working on this issue, we found out that there were maybe $40 billion worth of improper payments being reported by federal agencies. Last year, it was about almost $100 billion. So it sounds like we're going in the wrong direction. As it turns out, what's actually happening is more agencies are reporting. So initially, not very many agencies were reporting, but as we have a fuller reporting by all the agencies, we're finding have a better idea of how big the problem is. And it's not so much that it's getting worse, it's just we're having better reporting from the agencies. And now that we're getting that, the key is to make sure that agencies that are making improper payments make fewer of them, and then we go out and recover the monies that have been improperly paid. The White House announced this winter an executive order earlier this year to not only improve the collection of improper payments, but to also improve our ability to avoid making improper payments and to increase, what I think is really important, the use of recovery auditing. And I say the words recovery auditing or post-audit cost recovery. I think for most people, their eyes kind of blur over and they tune out. We're talking about $100 billion here. Money that is going out, most of it improperly, a lot of it overpayments. And we're talking about a country where our deficit is over $1 trillion. And if we have the ability to, if we're going to have the ability to reduce our deficit, it's not going to come from any one silver bullet or any one particular approach, but this is one approach that can really help. And I want to applaud the administration's concrete steps to improve transparency and make agencies and agency leadership more accountable. Still, there's a lot more that we can do, which is why our legislation that's currently on its way to the president's desk is so important in order to take the next steps, especially when it comes to actually going out and recovering the money that we lose every year to avoidable errors and preventable fraud. As I often say, my staff's heard me say this more times than they care to remember, if it isn't perfect, make it better. Everything that I do, I know I can do better, and that includes making sure that we're making the appropriate payments to the right pay for the right amount of money. And all of us in Congress share a responsibility to do that. That is to make it, if it's not perfect, make it better. We all share a responsibility to do that in curbing waste and fraud. The legislation that I think the House is going to pass later today and hopefully the President will sign later this month, it's called the Improper Payments, Elimination, and Recovery Act. It's the result of a 6-year journey. During the last Congress, I introduced the earlier iteration of this bill with Senator Claire McCaskill of Missouri. Over the last several years, I've chaired hearings on the issue of improper payments, waste, and fraud. And since then, we've worked with the Office of Management and Budget, the Congressional Budget Office, and many other inspector generals and many others, experts to refine and strengthen our legislation. The most recent version of that legislation was introduced last summer, about a year ago, along with Senator Lieberman, chairs our full committee, Senator Collins, the ranking member of the Homeland Security Government Affairs Committee, Senator McCain, and Senator McCaskill. It was approved by the Committee on Homeland Security and Government Affairs late last year and was approved by the full Senate in June of this year. A companion bill was also introduced in the House by Representative Patrick Murphy from Pennsylvania, our neighbor to the north. This legislation is, I believe, a perfect example of common sense, of bipartisan common sense, and bicameral common sense. And actually, if you consider that Senator Lieberman is an independent, it would be like tricameral, or like tripartisan, rather. And we have the Democrat, Republicans, and independents. I think the bill makes a number of key reforms. First of all, it improves transparency by lowering the threshold whereby agencies are supposed to report improper payments. And this will better inform the public about where their taxpayer dollars are going, and it'll help us in Congress to find ways to fix the problems that lead to waste. Second key reform in this legislation is that it requires agencies to produce audited, corrective action plans with targets to reduce waste. It's all well and good that we report improper payments or wasteful payments. The key is to stop doing it and to not just report them, but to go after and stop repeating the same mistakes. A third reform is that this legislation increases the recovery of overpayments by requiring all agencies that spend more than $1 million a year to perform recovery audits on all their programs. And finally, fourth and last, the legislation penalizes agencies that fail to comply with federal financial management and accounting laws, would make sure the progress in eliminating improper payments is part of senior agency officials' performance evaluation. So you say to somebody who's like a leader or supervisor in these federal agencies, part of your evaluation is going to be whether or not you're doing a good job of stopping overpayments, going out and making sure you don't make more of them, and going out and collect money that's been mispaid or overpaid. I'm particularly pleased with the provision in the bill requiring major agencies to make greater use of tools that many private sector businesses use to recover overpayments when they make them. And when agencies have used these tools, they've had some success, some real success. About 7 years ago, 2003, the Congress mandated what at the time was described as a pilot recovery audit contract program to examine Medicare fee-for-service payments. In other words, Congress said, okay, Medicare, and when you're making these fee-for-service payments to doctors, hospitals, nurses, we want you to do in 3 states, California, Florida, and New York. We wanted to look at those 3 states and see if we're overpaying money. And if we are, making mistakes in Medicare, go get it. I think a year or so later, we added to the initial 3 Massachusetts and South Carolina. During the first 3 years of this demonstration program, about $50 million was returned to the Medicare Trust Fund. The second year, about $250 million was returned to the Medicare Trust Fund. And I think if you add up the total for the 3-year pilot program, which ended up being in 5 states, they recovered about $1 billion. It's real money. And one of the reasons why the Medicare Trust Fund is running out of money is because of fraud. Some people may have seen I think it was 60 Minutes, a year or so ago, 60 Minutes did a special where they focused on a bunch of doctor's offices in some town in South Florida. The doctor's offices had 3 things in common. 1, they had no patients. 2, they had no doctors. 3, they had no nurses. All they were like a billing operation for Medicare to defraud money from Medicare and take it from the Medicare Trust Fund. Last year, we were looking for the Medicare Trust Fund to run out of money in about 8 years. That's untenable. And with the changes that we made in the healthcare reform legislation, I think we've pretty much doubled that life to maybe closer to 15 to 20 years. But we still have a problem. And with all the money that's defrauded from Medicare, we want to recover as much as we can and put it back into the program. But in any event, the pilot program, to start off with 3 states, expanded to 5, then to 19. This year, we're expanding it to all 50 states. And there's also a provision in the recently enacted healthcare law. It's called the Patient Protection and Affordability Care Act. It's the healthcare reform legislation adopted earlier this year. But there's a provision that says that we're going to the folks who run healthcare at the Department of Health and Human Services, they have to expand this program, this cost recovery program, to include Medicare Advantage, to include the Medicare prescription drug program and also to include Medicaid. And as money is recovered from fraud and overpayments, mispayments in Medicaid, that money will be split between the states and the federal government. The sooner the full program is up and operating and the sooner we can recover even more money, I think probably billions of dollars in additional overpayments. And there's an added benefit to an expansion of recovery auditing. The Recovery Audit Contracting Pilot Program has identified dozens of vulnerabilities in the Medicare payment system that can lead to additional waste and fraud. According to the Centers for Medicare and Medicaid Services, that's the entity that oversees Medicare and Medicaid. But the contractors hired to recoup overpayments identified ongoing vulnerabilities that could lead to future overpayments totaling about $1/3 billion more. So not only did the contractors recover about $1 billion in overpayments in the 3-year pilot program, they've also identified additional problems in their systems that they looked at, which if we will address, will eliminate and reduce reduce and avoid errors in the future. Tomorrow, what's today? Wednesday. Tomorrow, Thursday, I think tomorrow afternoon, the Subcommittee on Federal Financial Management, which I'm privileged to chair, we'll hold a hearing. In that hearing, we'll examine the history and the opportunities for Medicare recovery audit contracting. And I would say, in conclusion, Mr. President, the Improper Payments and Elimination Recovery Act, which we're, again, hopefully the House will pass today and the Senate has already passed it, and hopefully the President will put his John Henry on it later this month. But that legislation will allow us to make even greater strides in curbing waste and fraud in the work of federal agencies during the years ahead. Given the size of the budget deficits we face, we need to do that. Enactment of this legislation is not the last step. I think it's an important step. And I look forward to seeing this important legislation signed into law and to working with my colleagues and with the administration on its successful implementation. A lot of times people say to us, Mr. President, why don't you do something about waste, fraud, and abuse? And they're convinced that there's a lot of money, their money, that ends up being misspent, improperly spent, overpaid in some cases. The people or entities, businesses, that shouldn't get any money. Somebody ought to do something about it. And with the legislation that will be on its way to the President, hopefully tomorrow, we're going to do something about it. And we already are doing some pretty good things about it. We're going to do more. And we need to build on that record. Thank you very much, Mr. President.